Good afternoon, everyone. My name is Grant Miller. I'm a faculty member in the Department of Health Policy, and on behalf of Iran Ben David, co-organizer of the symposium today, and all of Stanford Health Policy, we want to welcome you to the Rosenkranz Global Health Policy Symposium. Right off the bat, I really want to say, first and foremost, a huge thank you to all of our staff who have suffered with Iran and myself and really made today possible. So please join me in giving a warm applause to our staff. So I just took advantage of my position seating near the front, and I was talking to Mark Dybul a minute ago, and we're in for a really wonderful session with him today. For our keynote. If you have been here for our research program earlier in the day, you're sick of seeing me and you're almost done with me. And I'm going to get out of the way very quickly. Before we get on to our keynote, I have the pleasure of announcing our winner of the Rosenkranz Prize for this year. So I serve as chair of the Rosenkranz Prize Selection Committee. I was joined this year on the selection committee also by Suchi Anand and Mike Bayoki, whom I'd like to thank very much. If you're not familiar with the prize, it is intended to both recognize and support rising scholars at Stanford doing innovative and impactful work to improve health in low and middle income countries. It is named in honor of George Rosenkranz, so I want to tell you briefly about him before I announce this year's prize winner. I have a little bit of text here, and I'm threatening to take out my reading glasses, which I've learned go hand in hand with my hairline, but I'm going to see if I can get away without it. So George Rosenkranz was born in Hungary in 1916. He trained in chemistry under Nobel Prize winner Leopold Ružička. As part of a team, Dr. Rosenkranz helped to synthesize cortisone, which you may have heard of, in 1951. And this discovery, which was made in Mexico, was critical to shaping Dr. Rosenkranz's career focus. Later that same decade, Dr. Rosenkranz's team went on to synthesize the active ingredient for the first oral contraceptive. From there, Dr. Rosenkranz partnered with a Wall Street investor and became CEO of the Syntex Pharmaceutical Company, which was a position that he held until 1981. As part of his work and as part of his broader interests, Dr. Rosenkranz had great concern for reducing health disparities around the world, and the Rosenkranz Prize is supported by the generosity of his family to honor his legacy. So turning specifically to the prize, I have to admit, if I can be personal for a minute, we don't have a School of Public Health here at Stanford, and we don't have a School of Public Policy here at Stanford. So sometimes I have to confess, I actually think that Stanford maybe is at a little bit of a disadvantage when it comes to building community focused on global health. But as chair of the prize committee, I'll tell you, year upon year, and this year is really no exception, I'm really resoundingly reminded that that's not the case, and that there is really a very vibrant and diverse and strong community focused on global health here at Stanford, which is very exciting to me personally. So the selection committee is delighted to announce that the winner of the Rosenkranz Prize this year is Dr. Natalia Serna Borrero. She's an assistant professor of health policy. She's also a center fellow at the Stanford Institute for Economic Policy Research, or CEPR. She's an economist focusing on the intersection of health economics and industrial organization. What we would be doing in a minute ordinarily is we would be inviting Natalia up to the stage. She's very modest and so presumed there's no way she would win the prize, and accepted an invitation to give a presentation on her own research somewhere else, which is actually where she is. So she's unfortunately not here with us today. If you don't know her, I would strongly encourage you to reach out to her and get to know her. And I should also tell you that rather than letting me misrepresent her work, which would be my next instinct, she asked me to read something to you on her behalf. So instead of telling you about her myself, I'm going to read something that she asked we do so. She writes, being awarded the Rosenkranz Prize is a testament that scalability of health systems research in low and middle income countries is valuable for policy and market design as well as for population health. The questions of how governments intervene in markets to ensure high quality insurance coverage for those most in need, how health insurers choose which hospitals to cover and which markets to participate in, and how competition between insurers and between providers impacts patient health mostly have been studied in the context of high-income countries. Answering these questions for low and middle-income countries that share similar market structure is important for the goal of reducing health disparities around the globe. My proposed project will study the impact of price ceilings on oral contraceptives on women's health, outcomes, and access to medications. This project was prompted by the fact that market regulators in many countries use price regulation to control rising healthcare spending, and by the fact that Latin America has among the highest teenage pregnancy rates in the world. My focus is the Colombian healthcare system, where in 2019, the government imposed price ceilings on 64 oral contraceptive brands that were being sold at prices 3 times higher than in Canada and in Norway. I hope that this research will inform governments in low and middle income countries generally on the best policies to control medication prices and on potential unintended consequences of price controls on patient health. So Natalia graduated from ICESI University in Cali, Colombia, with a bachelor's degree in economics and an international business, and also with a master's degree in economics. She then earned her PhD degree in economics at the University of Wisconsin-Madison. So please join me in congratulating Natalia. Okay, so you really are now done with me. What I'd like to do next is to welcome to the stage Dr. Michelle Berry, who is Stanford's Senior Associate Dean for Global Health and Director of the Center for Innovation in Global Health, to introduce our keynote speaker for today.
Thanks.
Thank you.
Good afternoon. It's my pleasure to introduce Dr. Mark Dybul, our keynote speaker for the Rosenkranz Symposium. Mark is a professor in the Department of Medicine at Georgetown University Medical Center, where he serves as the Chief Strategy Officer of the Center for Global Health Practice and Impact. He's the interim chair of Purpose Africa, which we'll hear a little bit more about, and CEO of Renovaro, Inc., a biotechnology firm dedicated to advancing healthcare innovation. Mark got his AB at Georgetown University, as well as his MD. He then did his residency in internal medicine at the University of Chicago. And then I heard he turned down a fellowship at Stanford in infectious diseases to go to NIH to work with Tony Fauci. And that he worked there for many years, really studying HIV, the basic virology, immunology, and treatment optimization. And he was involved in the first randomized controlled trial with combination antiretroviral therapy in Africa. His first supervisor was Drew Weissman. For those of you who don't know, he received his Nobel Prize for his role in the mRNA COVID vaccine. I think where Mark really has made an unbelievable impact, not only in this country, but globally, is he was really one of the original architects of PEPFAR, the Presidential Emergency Fund for antiretroviral, for AIDS relief. Excuse me, I can never remember what PEPFAR actually stands for. But he was really the principal architect, and he really started off as the chief medical officer, became the assistant deputy and acting director, and then he was made the leader of it in 2006. And really worked there for at least how many years, Mark?
Seems like forever. Till 2009.
Just 2009. And then, just to top it off, he then went off to become the executive director of the Global Fund to fight AIDS, TB, and malaria. And he worked there from 2000 to 2017. Mark has written extensively in science and policy literature. He's received many honorary degrees and awards. He's a member of the National Academy of Medicine. And I don't want to go through these. What I like to do is I always ask when I'm introducing somebody to come up with 3 things to actually tell me about themselves that I wouldn't find in their wiki page. So I called Mark, and these are his 3 things that you would not know about him from his wiki. 1 is that being in nature is my happy place. 2 is I'm obsessed with the illusion of space and time. And 3, I have the best husband in the world. So I welcome the best speaker for us today in the Rosenkranz.
Thank you, Michelle, and Grant and Aaron for inviting me to be here today. And thank you all for coming. It's such a beautiful day. I'd be outside if I were you, but thank you for taking the time to come. The topic that I picked for this, I actually never make slides. I don't know how to make them, actually, so sorry about that. Or it's a good thing, because I don't like slides very much. As I often joke, I'd rather talk about information and data than have slides. The topic that I picked is the once and future greatness and goodness of global health. Many of you in the room don't know that there was no term global health 25 years ago. It didn't exist. We had public health, we had other, but there was no term global health. And then in 2000, extraordinary things started happening. And health wasn't on its own. It actually was in the context of a radical change that was happening in the world, an openness, a globalization, health fit into development, which fit in with more than just health. It was a much bigger picture, In fact, what started a lot of the changes is something that is an extraordinary document called the Monterey Consensus from Monterey, California, Monterey, Mexico, where the meeting was held. International documents are often thousands of pages. This is 5 pages. And it radically changed the way we used to do things. Development, health, what we used to do was really based in post-colonial guilt and the Cold War. And in 2000, the change was we had to change all that. And the principles of that document are very clear and very straightforward. First, country ownership. We had to stop the notion that we're coming to save. It actually is country ownership. We are partners, if anything, the junior partner. The second is accountability. And most people jump to corruption, but that's not really the heart of good governance or accountability. Accountability is about achieving results. We used to talk about how much money we spent, not what result were you getting for it, what was happening, what was being achieved. Engagement of all sectors. And this was the sticking point, actually, because the Europeans didn't want the private sector involved at all. Didn't want anyone but government involved. It was just to be government to government. But of course, government to government can't achieve everything. So that principle of all sectors had to be engaged. And then the last piece was economic growth will be the engine to drive development and better health. And the data are actually pretty overwhelming on that. That consensus helped drive really what was a golden age of not just health, but in development. It led to the Millennium Development Goals. We now have the Sustainable Development Goals. The only good thing to come out of that is this pin, probably. Gavi was established, the Global Alliance for Vaccine. Well, actually, they don't call it that anymore. They just call it the Vaccine Alliance, but it used to have a name. Gavi was created based on those principles, structured based on those principles. The Global Fund was created, Global Fund to fight AIDS, TB, and malaria, based on the same principles. PEPFAR was created, the President's Malaria Initiative was created, but it was in a context of something much broader that was happening, which was an understanding of a globalized world, an engaged world, that we were in this together, and that we needed to work together, and that we needed change, that the world was changing and we needed to change with it. Since that time, and even pre-COVID, we began a massive retrenchment from that. It really started about 7 years ago, 8 years ago. Getting back to nationalism, getting back to protecting our own, getting back to self-orientation, top-down, overriding the countries, a lot of racism, paternalistic stuff, which existed. There was no Millennium Development Goal for antiretroviral therapy. because people in 2000 stood on the floor of the General Assembly of the United Nations and said Africans weren't smart enough, couldn't do it, there's no way to do something as complicated as chronic therapy in Africa. Best we could do is prevention. And by the way, the subtext was, and if we give them antivirals, they're going to create resistance, that's going to hurt us. So it wasn't pure by any stretch of the imagination in 2000, but there was a different sense, that we needed to change, and we've taken a massive step backwards, and COVID has just emphasized that. And the more, at least I look at it, the more what seems to be happening, which we see in this country, it is a global phenomenon. We have never been, in our history, the world has never been in the type of change we're in. We haven't had this kind of radical change really since the World Wars, and before that, the Industrial Revolution, and before that, thousands, literally, with the exception of the United States, for 1,000 years, the global socioeconomic order was stable. And that's radically changed. 75% of young people are now in a different part of the world. Europe and the United States are on the decline. And people are moving. People are moving in ways that have never happened before. So during all of World War II, 80 million people moved around the world. The year before COVID, the United States alone had 350 million people move in and out of it. Now, it wasn't immigration, but immigration's gone way up too, which has been driving a lot of the political change. When people move, it scares people. Ideas are moving quickly, faster than ever because of technology. And when ideas move, that scares people even more than when people move. Think about the Gutenberg Bible. Think about what happened with the printing press. People are afraid of losing what they have. The old world is afraid of losing what we have. When we get afraid, we do stupid things. And fear's constant companion is hate. And that starts to divide us. So while we were coming together and global health was a manifestation of that, built in a bigger context, 25 years ago, we are now pulling ourselves back apart, largely driven by this fear and hate. So what can we do about it? Well, just like 25 years ago, we need a new era, and we need a new term. Global health is a terrible term in my view. It's not the right term for the future. It was a great term 25 years ago, but we're in a new world and a new place. And it has to be different. So what are the things that can help us change that? Well, technology is one of them. Technology is key to changing where we are. And similar to where we were before, and just the fact that we have global health and only talk about global health, we need to open ourselves up, in my view, to something much broader than that. So what I like to talk about is healthy people living on a healthy planet, which makes people scared because they're like, oh, that's too complex. What's going to happen to all of our little world? But technology can drive that. There's health tech now. There was fintech. Now we have health tech, which is use of AI. Health tech. There's biotech. There's environmental health. There's agrotech. These worlds actually have a massive Venn diagram. What drives environmental damage? Urbanization, pollution, destruction of our food sources, loss of forests. That's terrible for our health. It's terrible for the planet's health. If you look at food security is right in the middle of all that. The same thing happens. Urbanization, pollution, destruction of our environment. That's terrible for food security, which is terrible for our health. The Venn diagram between where these areas overlap is massive, but we don't focus on that. We focus on what's outside of the center. We focus on the individual pieces. So I actually like to talk about Ventech. Where does it all come together? And that is our way out. And the way out comes from not being afraid, we were just talking about this, being afraid that the healthy planet or the environment is a threat to global health. They're related. They're the same thing. And what's exciting to me is when you go where the young people are, where the 75% of young people are, except for some of you here, which is in a different part of the world than it used to be, that's how they think. When you go, I've been to tech parks, Ed Mills, who's here, we've been in tech parks in Kigali, in Amsterdam, in Dubai, in Abu Dhabi, in New York, in Los Angeles in the last 6 months. By far the most exciting is Kigali. Young, dynamic people they do not see health as separate from environment, as separate from agriculture and food security. They see it all as one. And they're trying to come up with what are the tech solutions that will solve multiple problems, not just one problem. And if that is supported, then things can change. There's an effort called the Bridgetown Initiative, which is started by the Prime Minister of Barbados, who might be the next Secretary General, taking a look at what was happening because 2/3 of the world is where climate change is going to basically bury all these little planets. But instead of thinking about just little countries and islands, she said, well, let's look at the whole world that's being affected by this, and brought everyone together. And there's a health component to that. So there's a movement to try to pull these things together. But our systems, international systems, national systems, except when you get local, our systems were not built to deal with this pace of change. Our systems were not built to easily put things together. Think about the university. Think about it just in a university, trying to bring people together across disciplines. Now do that on a global scale and think how complicated it is. But when you get local, when you get into communities, they see problems as being together. And if we support them, they will come up with the solutions, and they will come up with that then tech solution, something that will help us solve multiple things at the same time. And that means we need to fundamentally disrupt and decentralize and decolonize our current international systems and our current national systems to get down to local systems and to have new centers of gravity. And one of the key pieces to creating those new centers of gravity, in my view, and Ed Mills is here, and that's what Purpose Africa is, we firmly believe that Africa can and will be a future, in 7 to 10 years, will be a future of where this Ventec happens. Will be a future of end-to-end, from the beginning of the value chain to the end of the value chain, from discovery through to new product thought and creation, and drug development, or product development, I should say. And this is true for everything, not just health, to studying it through clinical trials, to produce it, to have regulatory systems around it, and then to provide it to the world. Not just for Africa, which is how everyone's thinking right now, but for the world, to become a disruptor in research, end-to-end research and development. If that starts to happen, we can solve our problems. But it has to happen in that way, in that disruptive, decentralized, decolonized way, where everyone's involved, where we get back to those Monterey principles, where we get back to that conception. So we've actually started. We were just meeting with one of your faculty members who had the same idea. She's Zimbabwean. We've already started with 3 countries who are putting together plans to start where you can start. And that's what we did with PEPFAR. That's what we did with start where you can start. When people say you can't do it, just find a way to start, and then you'll grow from there. So where can you start in research and development? If you're thinking in biotech, health tech, you can start with clinical trials. Why? Well, Stanford did the same thing. Georgetown did the same thing. If you run clinical trials, you have money coming in because someone needs to get their drugs through to market, or products through to market. That creates revenue. From that revenue, you can then build back out to discovery, and then you can build forward to production, and then supply. So start where you can start. Start with building clinical trial capacity, because then you'll have revenue in a sustainable way that you can then build out from. And if the people are getting that revenue, see research and development not through the lens of what disease do I have, or what product can I create, but what are our problems and how do we fix them, and how can we fix across multiple fields with a single solution, say to urbanization or to pollution that would do dramatic change in our health. Well, that's how we can end. That's where we can get to if we start where we can start. And when you do that, you can change things. And the example of that to me is what happened with PEPFAR and the Global Fund. Literally, as I said, 25 years ago, people stood on the floor of the General Assembly and said it was impossible to deliver antiretroviral therapy in Africa. Impossible. They couldn't do it. They didn't have the systems, they didn't have the education, they didn't have the supply chain, all of which is true. You can always come up with 1,000 reasons not to do something, find the reason to do it, and find the way to start to do it. And it was in communities that they solved the problem. Yes, we had the money, and yes, we did. But what really happened is people in communities figured out how to get antiretroviral therapy to villages where the roads would get wiped out every year. They figured out the solution. They figured out the implementation. They figured out how to solve the problem. If they have the control, if they have the mind, they will find the solution if you start where you can start. So, for those of you who are the future, come up with a new term. Come up with something else to become global health. Come up with a new approach and a new system and a new way of doing things, because the old ways clearly are not working. And you're the only ones who are going to come up with it. We have clearly demonstrated we're not going to. You're the only ones who can do it. And don't be discouraged when people tell you can't, or because the problem seems too big. And I know that because that's what people said about PEPFAR. You can solve almost anything if you start where you can start. And then you can go from the fear and hate to hope and love and a world that we want. So you can create the world you want. No matter what anyone tells you, you can actually do it and get us out of the way. So now I think you and I are going to have a conversation.
Wow, thank you. Thank you, Mark. Thank you for these inspiring words. Thank you, everyone. Thank you, Grant, for doing this with me, and of course, again, to our staff. Well, Mark, you've led PEPFAR. You've led the Global Fund. You've traveled to a lot of places. Do you still enjoy travel for fun?
Yes. No, travel is one of my husband, one of our biggest passions.
Okay.
We just bought an apartment in Barcelona because we love travel so much. I don't like the plane part or the airport part, but I love being in other places because you're exposed to something new. You're always exposed to different, whether it's food or culture or just ways of looking at the world. People look at the world in different ways, and if you don't interact with that, you're going to calcify. So the only way to stay alive and young is to just keep new experiences.
Yeah, that's wonderful. But in your travel, your time in these organizations, what are some of the most memorable places you've seen?
Well, since nature is one of my favorite things, I mean, it's hard. It's hard because the answer to that is almost always the last place I've been, because there's always something amazing about every place you go. I would say one of the greatest gifts of the jobs I've had is being able to go back to the same village that I visited in 2000, 20 years later, and to see the hope and despair that are the absolute. It's very difficult to describe, and even people from the Bay Area who lived through HIV here, and I was here, actually did my 4th year of medical school at UCSF, working with Mark Conan in an HIV clinic in downtown San Francisco, where I sat with 17-year-olds who were dying because none of their friends would come visit them, none of their family would come visit them. That is a microcosm of what was happening in Africa. I mean, literally villages were disappearing. Everyone thought they were going to die, and they had good reason. I mean, 75% of pregnant women in districts in Botswana were HIV positive and were going to die. 75%. So the death, what the death caused is this hopelessness, absolute abject hopelessness. In fact, we met a woman HIV positive woman in Namibia, in rural Namibia, who had named her child No Hope. Oh. It was in the local language. The most hopeful thing in the world, to have a child. She named No Hope. People, why get yourself educated? But you go back 20 years later, and they're Kigali. I mean, it was just after the genocide, right? And they had a massive HIV problem, in part driven by the genocide. Now it's the most vibrant, dynamic place. It is extraordinary. So to have the privilege to go back to the places and see what's changed and how it's changed and the dynamism of the young people and the opportunity of that, I think that's the real gift. So, I mean, the physical beauty, the people, the smells, the sounds, everything. But to see those switches, that's probably
its own
the greatest
gift.
thing.
Yeah. let me touch base on some of the topics you brought up. Okay, so global health, as you mentioned, in the early 2000s, spurred by the Monterey principles, super sexy. It's like Gavi and Global Fund and PEPFAR and the President's Malaria Initiative. Funding was increasing, a lot of excitement. As you say now, some things have changed maybe about 7, 8 years ago. To what extent do you think global health has been a little bit a victim of its own success? To the extent that that maybe things had felt somewhat stale, or to what extent is the success of global health has now helped it in some way stall?
Yeah, I think it's a really good question, because people are like, oh, why malaria? We've done really well on maternal child health is a lot better, and if you link it to other things, poverty's gotten a lot better. Well, it's gotten better below the surface. If you measure poverty by $1 a day, yeah, people have come out of poverty. So I would say in part we're a victim of our own success. I think we're a victim of our lack of creativity. Because if we keep trying to do things the way we did 25 years ago, no one's going to keep, the world's changed. So why would we do that? But we still want to do it the way we were doing it 25 years ago. In fact, we've gone backwards, in my view. So I think we're a victim of a lack of openness and creativity. If we actually see health as part of this bigger picture, and how do we contribute to that? How do we bring our knowledge in? How do we bring everyone together? Then we will succeed. If we keep trying to stick to the same thing, no, we're not going to succeed, nor should we, because it's the wrong thing to do.
Let me try to dig deeper into, you mentioned healthy people living on a healthy planet, or I'm not sure if I got the words exactly right, but so there's a potential aspect there that's about topics that are pretty broad, things like environmental health and pollution and food systems, and then there are some things that are still in some ways malaria and HIV and tuberculosis. So some of these are kind of, almost like long-term risks, and some of them are immediate-term risks. How do you think about balancing, those? So in some ways, like as a physician, like the patient in front of you is the one that you feel most compelled to deal with. How do you think about the balance of things that are immediate versus the things that are more long-term?
It's a great question. This is what policymakers struggle with limited budgets all the time. I really do find policymaking fascinating, because you really have to struggle. And by the way, I tell people, anyone wants to go into health, if you want to go into a decision-making role, you have to be comfortable knowing the decisions you make is going to cost someone their life. Because every decision you make in favor of one thing is going to cost someone else somewhere something else. So you have to, if you're ever comfortable with that, that's a problem. But if you understand it, then that's different. So how do you make these decisions? How do you balance these things? To me, the only way to do that is always think of both and, not either or. How do you put things together? And if you took all the money that we spend on development writ large, and you look at all the UN agencies doing the same thing, I mean, just take one simple example. We were talking about this a little bit at lunch. Why on earth does Gavi and the Global Fund exist as separate institutions? It's insane. The duplicative waste, the amount of extra money that costs, the burden it causes on the country. I mean, but if we do both and versus either or, we can actually, I don't think we actually have a resource limitation. We have a resource limitation in our capacity to envision what connectivity looks like. And then we have our own personal, I want my piece, which is what human-centered design is all about. There's a way to fix all that. I mean, you can actually work your way through it, but you have to want to work through it. And what I've found in all of these things, I think PEPFAR was a great example. I mean, people don't go into government or academics because you want to have fights over which office you get, or fights over how much that's not why you do it, but you get kind of sucked into it, because that's what happens in institutions. But if people just have a little bit of opportunity to do something, almost everyone wants to be part of something bigger than themselves and be part of something great. So if you just look for those opportunities, you open things in ways you can't possibly imagine. I mean, I've been doing this for 20 years, and especially recently from villages to heads of state. If everyone wants to be involved in solving problems. So if you just give that opportunity. So I think we create a lot of these dichotomies. And if we would stop it, now they're real, and there are real issues that we have to work our way through. But we could probably solve a lot more if we were more open and creative and expansive rather than reductive.
Would you combine PEPFAR also with Global Fund and Gavi?
That's a little bit harder, but yes, functionally. And I would combine, I actually tried to do this when I was in the US government. Why do we have the Millennium Challenge Corporation, PEPFAR? You know, we have investment parts of the US government that invest in things related to health and developments related to health. We have climate funds. I mean, why? I mean, it makes no sense. So you do need institutions. I mean, you have to have an institution to do something. You do need mechanisms to get things done, but you don't have to be reductive about it. You can actually be inclusive of it. So why do we have health plans for countries, not development plans? Why do we, it's crazy. It's literally crazy. But that's how we are institutionally, because that's how we developed institutionally. And I think one of the biggest problems is that institutions are incapable of stopping things. So I would combine almost everything. But you can't have separate institutions. You just have to have it connected. But yes, it makes no sense to me at all that we have all the separate stuff, because when you get to a person, they don't have HIV or TB. They don't just have pollution. They don't just have poor. It's not. That's where I love getting down to communities, because they don't, and the people in the communities, because they don't see the problems from an institutional perspective. They see them from, this is my life. And then they start coming up with solutions to those problems, which is what happened in the early days of delivering antiretroviral therapy.
So you've led PEPFAR, a US government, and the Global Fund, a big international. Which one was easier to lead?
Oh, Global Fund by far.
But, okay.
Oh, yeah, by far.
So
Yeah.
Why? Why is that?
Yeah, I had 4 board meetings a year, most of which I didn't even pay attention to, because they were, I mean, I literally would stand in the back, because the conversation, we had 8-hour conversations about what the word observer means. Meanwhile, we're like, a serious, I actually said that at the board meeting. I was like, you know, we got this big budget and strategy over here, and we just spent 8 hours talking about what the meaning of an observer of the board meeting is. And it was complex in that there were 25, 30 large funders. They all had different interests. And then we had to deal with the countries in a different way. And we didn't have any country presence, which is actually a good thing. But it was easier because in the US government, I mean, Congress is insane. I mean, working with Congress, I had a board of 700. I mean, between Congress, the White House, Office of Management and Budget within the White House, the National Security Council within the budget, the Office of the President, the Secretary of State, the Secretary of Health and Human Services, the CDC, USAID. It was a freaking nightmare. But you could get so much done. But it was a much more complicated thing. And the thing about PEPFAR, the Global Fund is a little bit different because it's an international thing, so you're not in anyone's backyard. I'm in Washington, D.C. with PEPFAR, and we had to create a startup that completely changed how we did development, that brought agencies together, which never happens, from the beginning, from scratch. And really, I only say this half joking, actually not joking at all. If I knew now, if I knew then what I know now about the U.S. government, I wouldn't have thought PEPFAR was possible. Because it's not built for that kind of creativity. It's not built to focus on results. It's not built to have agencies work together. It's not built to do any of that, which is what gives me hope. We were able to do it in an incredibly complex environment, so why can't we do that everywhere else? I mean, it really, that was the toughest thing I think anyone will ever do.
PEPFAR is obviously is well known in the global health world as one of the more effective organizations in terms of delivering results. It's also well known as one of the more unique organizations in terms of its bipartisan support. Tell us how that happened. How do you get that? Obviously, in this day and age, it seems impossible. But yeah, how does that happen?
It still has bipartisan support. Reauthorization fell apart off one issue and actually divided the Republicans, which was abortion, which is insane, right? I mean, defense appropriations don't pass because of abortion. You know, PEPFAR gets dragged into abortion debates. It's insane. But there's still very strong bipartisan support, but it wasn't easy at the beginning. And I was very naive about this. I mean, I really didn't understand how politics. I was at NIH. I mean, NIH is like, it's one of the most amazing places in the world. But you're off on your own, and you do whatever you want, and you just do science. There's politics for sure, but so I was like, of course the US government is going to support, of course, I worked for a Republican president, of course the Republicans will support it. The first meetings with the Republicans, they're like, this is dead on arrival, there's no chance, there's zero chance of this ever passing. Start where you can start. So what we did is very intentionally build a coalition. So what really interests people, when health people go in and talk to a member and say, we need $15 billion, which at the time was mind-boggling, for a program for health, they're like, yeah, you're a health person. As soon as you leave, I'm going to have an agriculture person. As soon as you leave, yeah, I'm going to have a housing person. So we got the private sector to say, look, I have factories in these countries. I can't keep my people. They're all dying. This is a problem for us. This is a problem for our economy. We had security people, generals, saying, this is a big issue. I mean, we can't field a peacekeeping force in Africa. This is a problem for us. So we got security people, peace and security people. We got the private sector. We got the faith community that believed in, which is mostly conservative, at least the ones that were heavily engaged. Not all are conservative. Some are socially conservative, but very progressive on social policies. But the faith community being involved was hugely important to getting the bipartisan support. And then we got the general NGO community. So it was a very complex coalition, and it takes a lot to nurture that. It takes an enormous amount. I definitely lost 10 years of my life from that. And then you have to spend time. And this is something people don't do in Washington, and do even less of it now. Literally, I was yelled at by I was an assistant secretary of state level. I was yelled at by other assistant secretaries for meeting with staff on the Hill, or with me for always insisting that both Democrats and Republicans be in the room whenever we did briefings. They're like, if now they won't meet with me, and you keep giving them all this information, so what we did is say, these are the results we're going to achieve. This is the timeline. This is how much it's going to cost. This is what it's going to look like in a scale up. And we would go in and tell them in a bipartisan way when it wasn't working, why it wasn't working. People are afraid to tell people why. They know it's not working. They can see it. Why we lie to them? Go, be honest. Explain. We went through this in COVID. If we just actually explain to people, we don't know a lot. No one had any idea how to do antiretroviral therapy, so explain that. Explain that we don't know, this is what we're going to try, and we're going to tell you if it works, and then but always meet with both. Always, always, always meet with both. And people wouldn't do that. Whoever was in power, because of the way Congress works, the chairs of the committee and all that, to have all the power, they would just meet with whoever was in power. So I worked for a Republican president. I always met with the Democrats. Always, always, always. The Democrats came in a couple years later into power. They literally called me and said, you're the only person who talked to us for the last 2 years. What can we do to help you? So just talk, be honest with people, talk with people. They're very smart. Doesn't matter what side of the aisle they're on. People are very smart. They're very dedicated. They're working, for the government. Just be honest. Talk to people. Don't be afraid to admit you made a mistake or what you're trying to do to fix it, and show results. And really, it's not that complicated. And take the time to talk with people who you normally wouldn't agree with. And you'll find common ground. You'll disagree on a whole bunch of stuff. But if you find the common ground, then you can move forward. So we always had disagreements. And the last thing I would say is compromise. Ted Kennedy, who I got to know pretty well, and I really had a lot of admiration for, has a remarkable line. And he understood this, because when he was a junior senator, when he was in his 30s, in the 60s, he was totally ineffective. Never got any legislation passed because he was just dogmatic. If you don't do it this way, you're wrong. And then he came up with, I can do that and get nothing done, or I can actually work with people and get something done. But his line was, compromise, but never compromise your principles. It's possible to do both. It's possible to do both. Sometimes you have to give up things you don't want to give up, but you get a whole lot that you do want, and over time, you can work on the other pieces. So never compromise your principles, but compromise.
It's a great, inspiring lesson. Okay, so we're in a university, and we've had today a lot of guests that have presented work on research, and research is obviously a big part of what we do, including evaluations. How important is showing results for the success of getting these programs through government?
It's all of it. It's all of it. And that was really the fundamental change that Monterey started. But really, and PEPFAR really drove this. The Global Fund didn't, the other programs did not. PEPFAR drove the result, accountability, constant reporting. The Global Fund's early reports on antiretroviral therapy, they give one number. They just say, this is how many people we're supporting treatment for in the world. I was like, which countries? No, we're not telling you. Literally, they were like, we're not telling you. And they had no mechanisms to, if you don't show results, which is the big shift in development, from how much money are you spending to what are you getting for it. People are very, very open, and this is where the bipartisanship came from. Mike Pence said on the floor when we were reauthorizing PEPFAR in 2000, Mike Pence stood up on the floor of the Congress when he was a member of Congress and said, look, we rarely get to stand on this floor and save millions of lives. They show that they can save millions of lives. We can find plenty of other places to cut budgets. So if you can show results, but be honest about it. People also inflate results. Be honest about your results, because you'll get killed if you lie. But if without results, without showing what you're doing, you can't succeed. But there you can be prey to your own success, because then you get wed to that number. And you can lose sight of what you're losing by focusing on that one thing. And so when you do that, and this is what we always did, and this is a big conversation, what we always tried to do is, what is the cascade thing to measure? So to achieve antiretroviral therapy, you need to have built community systems, advocacy groups. You need to build supply chains, communication systems, human resources. You had to do all of that to get to that number. So you monitored all that, but you couldn't get to that number. You could build I keep saying that you can build a health system and not have a single person who's healthier. So if you just want to focus on a system, you're in trouble. Focus on health, and then you'll have to build the system to get there. So the thing about indicators and measurement to me is, what is the measurement that tells you whether or not you're doing all the other things, so you don't lose sight of the other things that need to be done. And actually, you can cause more harm than good if you're not careful.
So on that, let me try to, again, get a tension that I sometimes feel in the global health policy world. If you focus on something like HIV or malaria or whatnot, you can really show results. If you focus on some things that are also important, sometimes the results are actually much more difficult to show. They can be very important, food security, and reduction of pollution, things like that. But very difficult to show results. So where does it leave us in terms of, in some ways I feel like part of the excitement about global health was that it focused on organizations that showed results pretty easily. It's much more, it's in some ways like that, it's much more complicated now. How do we think about that tension?
It's an excellent question, and I think it is one of those things we were just talking about, which is if you're too focused on a specific number, you're going to miss a whole lot of stuff. But it gets to antiretroviral therapy. So I'll never forget when I met with the head of the Office of Management and Budget 6 months into PEPFAR. He's like, how many people got on antiretroviral treatment? I was like, 25,000. He was like, 25,000? We just gave you $1.5 billion. No, you have to start with 25,000 because you have to build the system, because then that's what's going to happen. So you always have to. So climate change or urbanization. What can you get to first? If your ideal is to get to Z, what does A, B, C, D, and E look like? And then you take in pieces. Start where you can start, but measure those. Don't just say, well, we'll have to wait till the end. What are you going to achieve in this block of time that will get you on the path to that block of time, knowing that your path is going to deviate by the time you get there? So that's where you go. That's where it comes back to, what are your intermediary markers that will get you to that goal? And then be honest about what you're seeing and pivot. Don't get wed to whatever it was. Change. Be open to change. Take the feedback from the ground, see what's happening in reality, and change what you. That's why, that was actually my biggest fear about PEPFAR, and it's happened. This was my biggest fear about all these global institutions. They were so innovative and creative at the start, and now they became institutions and bureaucratic. The capacity to always innovate, to not get too stuck into where you thought you wanted to get. That's how you get to where you want to get. but you have to at least have some sense of what those intermediary steps are. And if you don't meet them because another obstacle came, shift and then explain why you shifted. But the notion that you go from, which I used to get all the time, they're like, oh, you can't measure antiretroviral. Literally at the beginning, people are like, you can't measure that. That's impossible to measure. We'll never get down to the clinics. We'll never get those numbers. Yes, you will, if you build the systems first. So spend the first 6 months building the system. We did the calculation. It cost $6,000 per person for antiretroviral therapy in the first 6 months, but after that, it dropped to $1,000 because you built the infrastructure so that you could just keep adding people into therapy. So what is your intermediary marker that will get you to your deeper marker? And then change, move. Which to the students, shifting a little bit. I never give advice because advice is what someone would do if they were you, right? So if someone says, I advise you, stop listening. That's a piece of advice too, actually. But the only thing I ever say is if you're doing in 10 years what you thought you would be doing in 10 years, you really messed up. Because you missed a whole bunch of opportunities that came your way because you were so focused on that one thing. And it's the same in policy. If you are so focused on this one thing happening in 10 years and are blind to all the things that could have changed to do even more than you thought was possible. So, we get so tied up in the individual things and it has to go that way. It never works. It'll never work that way. So change.
Let me go into this notion of change as well as compromise. You were very intensively engaged with a few countries during your time at PEPFAR and more countries in Global Fund. Some of those countries, had leaders and governments that were reputed to engage in corruption, abuses of power.
You're talking about the United States?
Not just.
Oh, okay.
But some of those governments were marred by allegations of human rights abuses. Okay. You're not the first nor the last, obviously, to work with such governments. Okay, tell us about how you thought about these, about these compromises, the tensions, and how to work with it, and what are some of your approaches for dealing with some of these characters?
Yeah. So I had to deal with a lot of them, and it is difficult, especially as a gay man working in an environment, and all the heads of state and everyone knew I was gay. I mean, Condi Rice called my at the time not husband because he couldn't get married. She called his mother my mother-in-law. And, everyone went. Actually, it was the left that went crazy, not the right. But which taught me a lot too about politics. It gets a little bit to compromise, but don't compromise your principles. So, what can you achieve that is good? Without turning your eyes the other way. So, and we did on a whole bunch of things, whether it was gay rights, because we had the entry point of health. So, and that changed the conversation. I mean, if you went, and I told people this, I mean, it was like, if your conversation starts with human rights, they're going to stop listening and they're not going to, but if you start with, did you know that because of men having sex with men, which also they all have sex with women because you're so anti-gay, that you're causing this massive problem in your country. Are people who inject themselves with drugs? I mean, one of the I hate pride, but one of the things I most enjoyed was really without PEPFAR, Vietnam never would have adopted methadone, and they never would have closed those god-awful camps that they were putting people in, the camps of social evils. So I had to go toe-to-toe with prime ministers and presidents, say this, but if you enter it from and there are people who need to enter it from human rights. That's what they do. That we need that. But if you're a health person, you can enter it from health. And if you give them the health argument, they'll actually do it. One of the, in some ways, most uplifting things is when Nigeria passed their really awful law, anti-gay law. I flew down to meet with the Catholic. So Nigeria is basically half Muslim and half Christian, and north-south, and it's Arab north and Christian south, and it's a little more complex now, but that's basically the way it is. And they had an interfaith council on health, which we helped drive. We actually helped create these interfaith councils to help deal with these challenging issues. And unlike the rest of the Muslim world, in Nigeria, the Sultan of Sokoto, who's actually a Western-trained, pretty progressive guy, is the word. So it's not individual imams. What he says goes. And in the South, the Christians always elected, and they rotated. And this guy happened to be Pastor Oyo, who is one of the most conservative people I've ever met, an evangelical pastor. Oh, my gosh. And I went down to talk with them about it. And they said, look, if you push us on marriage, we're going to resist. But if this is about health, we will. And they issued a statement saying, these are our brothers, these are our children, these are our family, these are our congregation. Everyone should have access to antiretroviral therapy. Everyone should get care. Everyone should be treated as equal on a health basis. They put this actual letter out with both their names on it. So if you can do these things, but it's not easy. It's uncomfortable. I had a really bad experience in Uganda. I actually was, anyway. But, you compromise, but don't compromise your principles. And find an angle where you can have a conversation about it.
That's awesome. Okay, I'm going to have to ask you about being openly gay in government. Now, 2024 in California, nobody would bat an eyelash about having someone gay in high levels of government. But this is 2002, 2003. Tell us about the norms and how you thought about your own role and your role in changing norms, and some of those, kind of more I don't know, experiences that time.
It was certainly interesting, especially and there's a great understandably about the Bush administration and where they were on these issues, and people are shocked that I was an openly gay man. At the time, I was the highest ranking gay man ever in the U.S. government because I was an assistant secretary of state level, and that's a presidential appointment that has to go through this massive process and a Senate confirmed position. Actually, the problem for them was not that I was gay. The problem for them is I was a Democrat, and then became an independent. Karl Rove, actually, his mind was blowing. He's like, you can't put this guy in. He's a Democrat. President Bush didn't care at all. And then Congress was, the thing is, as people, you could always talk with them. Just be yourself and talk with them. I mean, I don't know if you guys know who Rick and Kay Warren are. They're evangelical pastors. They have told people in Africa, heads of state in Africa, ministers have told me that I changed their view on what it was like to be gay. They thought being gay was something different. They didn't understand, and then they started finding out there are other. So while they're still and they'll admit they're still kind of homophobic and they don't believe in marriage, but they've changed their view on what does it mean like. Just be yourself and don't throw things in people's face, but deal with it. And I would have to. Condi was great, but I didn't. Ed Mills and I were talking about this. I actually didn't deal with Condi that much because it was the president's thing. So now it's very much a State Department thing. Then it was the president's thing, which had to be because it would have died if it wasn't President Bush driving it all the time. So I dealt with the White House, which is a great thing for a Secretary of State to say, I don't care, you report to me, but go deal with the White House all the time. They're going to make the decisions anyway. They were amazing. I mean, they would invite me to things that an assistant secretary of state. So there are holiday receptions, like 100 of them every night, and the president. But then there are dinners, small dinners of 100, and there are like 100 people, and there are 6 of them, and only closest friends and others are invited to those. We got invited to those dinners, and the first one we went to, they put me at Mrs. Bush's table, and as soon as we showed up at the reception, the president made a beeline and talked to us the entire time. Oh. To signal to everyone, these guys are staying, and this is who we are. So they did things that were really remarkable. Yeah.
Were there times when it felt to you like it got in the way of your work, or that you had such resistance that?
No, because if you. There were certainly challenging moments where people would, in certain countries, say things, or I'd get asked questions by newspapers or in certain places. Like I went to speak to Kay and Rick Warren's church, and someone from Christianity asked me, how do you feel being amongst 1,000 evangelicals who think you're going to hell? And I was like, well, Rick and Kay don't think I'm going to hell. I don't think most of the other people here do either. So, just it does get uncomfortable. There are times, no question. But if you don't back down, if you be who you are and try to understand I always try to understand where someone else is coming from and find a way to talk to them.
Well,
not always possible, but you can try.
I think your experience has been inspiring to many people, and certainly has changed the ways people think about what's possible, even including the way that administrations are accepting of
including Republican administrations.
Yes, right. Okay, so let me you've talked several points about the role of private sector and potential ways that the private sector can get engaged in some ways in global health. Okay, so. One of our local heroes here was Ken Arrow. He passed a few years ago. He was, you may recall, he was one of the architects of a program called the Affordable Medicine Facilities for Malaria, which briefly it was a market-based scheme. It was a subsidy to deliver medicines for malaria that were highly effective but relatively costly. They were going to subsidize them to make them cheap so that they would be cheaper than the existing therapeutics that were ineffective. And it was a way of trying to get both the coverage of these medicines as well as delay any development of resistance. That program, you came on to the Global Fund right at a critical moment for the program, and that program didn't make it. How do you view these kinds of market-based approaches to global health, and then maybe now, and how's your thinking evolved about these kinds of issues?
I actually always strongly supported an AM/FM. It was one of the few times I disagreed with Tim Ziemer, who was the head of the President's Malaria Initiative, and that basically the U.S. blocked AM/FM on the board because and it wasn't for because of their support with the pharmaceutical industry at all, actually. It was a Democratic administration. It actually was because the people at CDC really didn't think it was going to make a difference in the pricing. And Tim accepted that. So it was actually a bureaucratic decision, not a political decision. And I think it was the wrong decision. So I'm a strong believer in market-based solutions as long as the incentives are the right incentives. So forward guarantees are fantastic. Price is all about volume. It's not about generics, it's about volume. Generics are important, no question, but volume drives everything. We always got the lowest prices from a generic company, I got yelled at by CEOs of pharmaceutical companies and from CEOs of generic companies because we drove the prices down by volume. And we tried to create something called WAMBO at the Global Fund, which again was killed for political reasons, oddly enough, by Médecins Sans Frontières, because they were afraid it would reduce prices so much that they wouldn't be able to win their bigger goal of ending patents. Literally, they told me that to my face. So it still exists, but it got killed. And it was going to be a global marketplace. It was going to be Amazon.com for all health. Global. We were starting in the Global Fund, but we had plans to spin it out into a global public health good that would have allowed countries to bid together. Small countries really suffer because they don't have volume. So Eswatini was paying $1,500 rather than $300, which they should have been paying, because they couldn't compete in the marketplace. If you give openings like that, you can actually do it. And not only that, but then you have an incentive for companies to compete because you have an open market. All you have to do is show that you're effective, and you automatically have a place in the market. So it would have blown away. It would have opened up global health in remarkable ways, and Médecins Sans Frontières killed it. So I'm a huge fan of market solutions if the incentive structures are right. You can have bad incentive structures that lead to bad market solutions. So a good example of that is what happened in the vaccine market. If you're really a big company, you can drop your prices really low to force everyone else out of the market. And if everyone just buys those, which was happening actually with antiretrovirals, then as soon as you're the only two left, your prices go up. And that's what happened in the vaccine market. And actually was a disaster. So then we had to go back. And so we actually started putting things in the Global Fund where we started breaking up monopolies on procurement, including requirements or giving extra points for production in Africa or in other places to break up the markets, even if you paid a little bit more. And we actually we calculated what that could be because it was a safer way for the future. So market solutions are great. You just have to make sure the incentives are aligned and that you don't fall prey to a shiny object that could actually be worse in the long run.
Yeah. I'm going to open it up in a few minutes for people to ask questions. Two last quick questions. One is, what are you optimistic about for the next generation in terms of engagement in global health?
There's a great ancient Roman saying, there's hope in death. So what I'm most optimistic about is you, because young people are going to solve the problems that we can't solve, because we can't see the solutions, because we were trained and we're brought up, and we have, as you get older, you start limiting rather than opening. But when I travel around and meet young people, especially in what we call with a horrible name, the global South, that's where I get hyper excited and optimistic, because they are so hungry, so creative. They will solve these problems. The only issue is, will we give the space for that? But in the end, it's not going to be giving the space. It's going to be taken, as it's being taken now. And really, those countries are done with us because of COVID. I mean, they really are. They're going to create what Purpose Africa, Ed and I are working on, and it's all Africans. We're the only two non-Africans involved. They're done with us because they know. They actually thought we were going to do a PEPFAR or the Global Fund for COVID, and we didn't, because we got selfish and didn't care about anyone but ourselves. So they're going to take it, and they have the capability to do it. The socioeconomic status has changed. I mean, these are great numbers for me. I mean, for years, the G5 had 44% of the GDP in the world. 5 countries. We're now down to 22, right? So the economic calculus is changing, and when you have 75% of young people in those countries, in low and middle income countries, there's only one way this is going. So are we going to be part of that and create? That's what I'm optimistic about. But I'm also a little pessimistic we won't. So the optimism is the young people are just going to do it anyway. They're just going to, and then the other part is we'll die. So they won't have to worry about us.
It's awesome. And something inspiring for young people who are, entering this field now, in terms of something to read or to anything that has inspired you in the past? Any books that are your favorite books for?
The book I always recommend to people is Bill Foegge's House on Fire. It's 100 pages, very easy read. And what I love about it is...
Is it about smallpox?
Yeah, it's about smallpox eradication. And what I love about it is what we're trying to work on, and what Purpose Africa is all about, actually, is it's not about the vaccine. It's about how they had to go community by community to figure out why people weren't taking the vaccine. And in one community, it was because the implement that they were injecting, or that they were using to vaccinate, looked like a weapon, and it scared people. So they had to actually change. But they actually went into communities to find all this stuff out. And by going into communities and learning, understanding why people were hiding people with smallpox in their basements, and that's how the whole book is actually about how to engage communities to solve global health problems. Technology is great; someone's got to use it. So that is a very inspiring book to me. Bill's a real hero for all of us. But I was fortunate to get to know him pretty well. But that's a very inspiring book to me. And then, the other thing I would say is write your own books. Write in your heads and in your hearts. Write your own book about what the world should look like. Don't take what we're handing you and say, I have to work within that confines. Create your own confines. Create your own systems. Create your own ideas. Create your own ways to break through. And so there are things you can read, but you should just read what you can and then create what you want.
So in the spirit of not hearing any more from the old people, I'm going to open it up to questions. And anyone who wants to ask a question, please go ahead.
Thanks for a wonderful talk. My question is, I'm curious to hear your reflections on how you see NIH's role supporting research outside of the US, and what changes would you like to see?
Your name's Nate? Was that?
Nathan, yeah.
Nathan.
Hey.
Thank you for the question, Nathan. NIH is a phenomenal place. It's the greatest research institution in the world. I was deeply privileged to be there. It should be blown up. I mean, I'm only half joking. Things like BARDA if you know what BARDA, DARPA, which brings private sector people in. The problem with NIH, it's a phenomenal institution. Really, it's done amazing work, and a lot of people sitting in this room, including me, have benefited from it. But it's old world in its bureaucracy. And actually, Francis knew this. Tony knew this. The whole system is built to just, it's not built to fund truly creative, innovative ideas. It's built to fund things that fit in with groupthink and marginal improvement. And we do a great job of that. And there's a lot of things that should be done that way because science is a slow, progressive thing. But you have to have mechanisms to allow big breakthrough ideas that are revolutionary, that are outside of the norm, to be funded. And that's really hard in the systems that we create because the systems are all reviewed and it's all done within the same groupthink. And if you're outside of that groupthink, it doesn't get funded. So I love NIH, and a lot of science needs to be conducted that. But that's why ARPA-H was created. I hope that and Francis created that because he could see the limitations of what was happening in NIH, which is a great place again. And a lot of science does need to progress that way. But you're not going to get the big breakthroughs. I mean, Drew Weissman, that mRNA vaccine, no one believed in for 20 years. He funded that by basically scraping money out of other grants. It's probably illegal how he funded that, actually. He was scraping money out of other grants so he could fund the woman who came in with the idea because he believed in it. But he couldn't get it funded. He could never get it funded. So, we need things like NIH, but then we need things that will fund big ideas, new ideas that break through the mold. Now, a good part of them will fail. That's fine. But let's find the ones that will succeed. We were just talking about this. We're in worse shape today than we were the first year of COVID. We are in worse shape from pandemic preparedness and response, from the cultural response that will come, from all of it. But if you look at how NIH is spending money on or not just on, this is not just NIH, but all research institutions, if you look at where money is being spent right now for the next pandemics, it's a waste. It is an absolute waste of billions and billions and billions of dollars. That's not going to make a difference. So, and then we're not spending enough. So you have to have other, but I love it. I do love it.
Go ahead. Yeah.
Just as a follow-up, my name is Press. That was
Sorry, what was the name?
Press. Press, yeah, nothing.
Yeah.
That was incredibly inspiring, and I think we all appreciate your candor. It was incredibly refreshing to hear that. But my question, just as a follow-up to Nathan's question, is how do you feel about charitable organizations, Gates Foundation, the role of these large, the almost outsized roles that these large organizations play in terms of setting the research agenda, setting the question agenda for what all of us that are interested in global health should be working on.
First of all, one of the nice things about not having the jobs I used to have is I can say whatever I want now. Actually, I almost always did, which sometimes caused trouble. But people like honesty, actually. I think they, a little bit like NIH, they play a role, and they're resources that go for amazing purposes. I actually think where they do their best work is like when they give it to the Global Fund or Gavi or the institutions that are actually do huge work. They do have a strong research component, but it's a little more like NIH research approaches. And they don't actually fund big ideas, which Bill knows because he keeps creating new things to try to fund things that are more innovative. Because he knows it's not going to come out of the foundation. And I think a lot of foundations fall into that trap. I would say someone like McKinsey Scott is the model for me, and I actually think that's what Melinda's going to do. She finds an organization that she thinks is doing amazing work on the ground, focused in the community, making a difference, and writes them a check. No grant application, no follow-up, you just get the check. But I also, there is a role for those foundations, and they have a right to fund policy. I mean, companies fund, corporations. A lot of our world's screwed up because we spend too much money on things that we shouldn't have, like the fact that we have no competition for drugs in Medicare is a good example of that. But we need more creative ways. So one of the things we're working on Purpose Africa is actually using blockchain and creating a coin for health. to contribute to health, because we know that people will fund things that they see a result for, getting back to result. Not with which was the old way, almost now it looks so bad, but it made sense at the time, a card from a kid saying, thank you for educating me. We respond when we see it happening. And with blockchain, we could actually do that. And if you think about it from a philanthropic perspective, you could raise, if 100 million people give $1, it's the same thing as Bill Gates giving $100 million, right? But it's actually going to someone without all the extra costs. So we have to think of new creative ways for philanthropy to thrive. But I do think they're useful because they set an example and a model for others with a lot of money. Because the vast majority of people with that kind of money don't do anything with it except buy themselves things or fight to hold on to more of it, not pay any taxes, right? So I think it's a great example of people saying, we have enough money, we're going to give a whole bunch of it away. They could do it differently, but I think it's great. But we also need other models. And I'm not saying the coin is the solution, but we need other models for many more people to engage so that it's a lot of people with a little money rather than a few people with a lot of money.
My name is Kelly Regan. I'm from Stockholm School of Economics. So I'm wondering if there's any particular challenges. I mean, I thought your comment about technology is great, but society has to use it. I'm wondering about, if we think about global sexual health, are there any particular challenges that you think we need to think about, or and the sort of ebb and flow of like you talk about the, Monterey principles, we were so advanced and we moved backwards. Are there particular challenges you want to think about when we think about global sexual health?
Yeah, I think you're hitting on a huge topic because we're going backwards on sexual reproductive health issues as well, in my view. Countries are stepping back on a lot of programs that they were moving forward on. At the same time, there's some positive things happening. And then external funding is just tanking, which is why things like the Susan Buffett Foundation and others that really spend a lot of money in these areas are so important. I think it's all related to in many ways, to the fear and the future looking so different, and we go back to our old patterns, including male dominance and all this other garbage that we have. But I do worry that we're taking big steps back on sexual health. The encouraging thing is how many women are stepping up into positions of authority and power in many countries, including in low and middle income countries, who have different, but they don't have the same views. I mean, some of them are pretty conservative too. So I do worry about support for gender-based, sexual-based, and not just gender, but all sexual. I mean, sex is politically challenging, right? That's why HIV just astounds me. I mean, Bono's right. Sex, drugs, and rock and roll. These are the things that scare the living daylights out of people. And again, when people get scared, you go back to your old ways. I don't have a good answer for it because I think it's so challenging. But similar to the gay laws that are being passed all over the world, I think we're going to see some really bad retraction on sexual reproductive rights laws and could do a lot of damage to a lot of people. So I'm glad you're thinking about it. I think your economic piece, I wish there were more people with economic and business backgrounds involved in these conversations about how important women are and how important the ability of a woman and a family to choose family size is to economic growth and development. I mean, it is fundamental to economic growth and development, fundamental to education, it's fundamental to everything. And those are the conversations I would have with the heads of state. If the conversation is, if for their perspective is different, and it comes from, and again, we do need the human rights argument, but you can also have other arguments. And in the end, the financial, the economic growth, what scares heads of state most right now is a lot of young people, no jobs, no economic growth. And the more we can link things to economic growth and development, and there's such good arguments on all of these things, I think the better off we'll be, but it's not a quick fix.
Well, thank you, Mark. Thank you for your honesty, for your forthrightness, for inspiring, for making us all think about changes. And thank you, everyone. Thank you, everyone, for coming. We have a reception, and I think we're just gonna open the doors and spill out down in that direction, and maybe
after a couple glasses of wine, then we'll really
that's right. But please join me. Come join me in thanking Mark for this wonderful event.